Hi, my name is Ebony, and today we'll be presenting our research on the effect of estrogen on chondrogenesis in female articular chondrocytes. This study was conducted in collaboration with the Bionics Cluster at the University of Central Florida College of Medicine and Rush University. Let's begin with the background. Cartilage degeneration is a significant issue for women approaching 50 years old, increasing their risk for osteoarthritis. Estrogen hormone replacement therapy has been proposed as a potential protective treatment, as suggested by clinical evidence of reduced hip arthroplasty, but its direct effects on cartilage cells remain unclear. Our study aims to explore how different estrogen levels impact chondrocyte proliferation and extracellular matrix production. Methods for the study, we used female chondrocytes from two sources: three donors who had undergone joint replacement surgery, and three healthy talus samples. The cells were cultured and treated with three different concentrations of estrogen, representing pregnancy, premenopause, and postmenopausal levels, respectively. On day 10, we introduced interleukin 1 beta to assess how estrogen influences chondrocyte response to inflammation. We observed chondrogenesis over 22 days with imaging and feeding every 2 to 3 days. And our sample analysis included histology, biochemical assays, and ImageJ software to assess aggregate size and proliferation, as seen in the image. Moving into the results, we had inconsistent effects. Taking the average metabolic activity showed various results across donors, with proliferation levels staying fairly consistent on average across donors. Moving into aggregate size, we had 0 nanomolar, 0.01 nanomolar, 1 nanomolar, and 100 nanomolar estrogen levels. And you can see here that when we do take the average over time, there are varying effects among donors again. When it comes to our staining results, glycosaminoglycan staining showed minimal differences, which was a consistent trend among donors. Immunohistochemistry staining shows there could be a difference between donors, especially when comparing osteoarthritis samples to healthy samples in the 100 nanomolar with and without interleukin 1 beta groups. Our biochemistry results provides, again, a donor-dependent effect where some donors responded positively to estrogen treatment while others showed minimal or no response. With these results in mind, this suggests that estrogen's effect on cartilage regeneration may depend on individual donor factors such as genetic background, tissue health, or prior exposure to inflammation. But the key takeaway from our study is that estrogen does not have a consistent effect on cartilage regeneration. Instead, the response appears to be a donor-dependent effect. To further explore this topic, future researchers should compare healthy versus osteoarthritic donors in a similar experiment, and/or investigate estrogen receptor expression in cartilage cells. Our findings highlight the complexity of cartilage response to estrogen therapy, suggesting that osteoarthritic treatments may need to be personalized rather than one size fits all.